So what is glaucoma? What are the symptoms? Who is most likely to get glaucoma? What are the treatments? And how do you protect yourself against glaucoma? Hi, this is The Business Guy. I have a biological science degree from Oregon State University. I was with Pfizer Pharmaceutical for 8 years, and I have glaucoma. Glaucoma is a general term used to describe a group of eye disorders that damage the optic nerve. In most cases, fluid builds up inside of the eyes, and this extra fluid puts pressure on the eye. The increased pressure on your eye, called interocular pressure, or eye pressure, can damage your optic nerve, which is the cable in the back of your eye that sends messages to your brain. If the damage worsens, glaucoma can cause permanent vision loss or even total blindness within a few years. People can develop glaucoma at any age, and there is currently no cure for glaucoma, making it a leading cause of blindness all over the world. Some people have normal eye pressure and still get glaucoma. Untreated or poorly controlled glaucoma can lead to permanent or irreversible vision loss and blindness. We're going to talk about the symptoms of glaucoma next, but if you could help me out by clicking the like button so YouTube promotes this video and this video helps more people, I'd really appreciate it. And if you haven't already, you can click the subscribe button below so that when more videos come out like this one, you'll be up to date right away. So what are the symptoms of glaucoma? Often there aren't any until you start losing your vision, and that's why getting regular eye exams is so important. Symptoms include eye pressure or eye pain, headaches, rainbow-colored halos around lights, low vision, blurred vision, narrowed vision, i.e. tunnel vision, blind spots, nausea and vomiting, or red eyes. Now, what prompted me to go to the ophthalmologist when I was diagnosed with glaucoma was slightly blurry vision in the left eye when I was driving. Then one day I decided to read with my left eye only. I was absolutely knocked over with shock. I could scarcely read a single word on the page. Normal pressure in the eye is 10 to 21 millimeters of mercury. You can lose your sight in 15 years with pressure of 21 to 25. 7 years with a pressure of 26 to 30. 3 years or less when above 30. Mine was 38 and 40. There was already damage to the optic nerve in both eyes, and without treatment, I could have been blind within months. I lost about 70% of my vision in my left eye, and the damage is permanent. Glaucoma is sometimes called the silent thief of sight because it slowly damages the eyes and can cause irreparable harm before there's any vision loss. But this disease is stealthy in more ways than one. Glaucoma has been known since antiquity, and yet research still does not know what causes it in most cases. Now, there are treatments to delay vision loss, but no cure. It affects more than 2.7 million people in the United States and more than 60 million worldwide. There are many forms of the disease, but primary open-angle glaucoma is the most common form and the most mysterious. That said, this is meant to be helpful information only, and none of this is medical advice. For that, see a licensed ophthalmologist. Who is most likely to get glaucoma? People with diabetes are twice as likely to get glaucoma. Other risk factors include a family history of glaucoma, though I got a severe case without a family history, farsightedness or hyperopia, nearsightedness or myopia, high blood pressure, long-term use of corticosteroids, or previous eye injury or surgery. Does glaucoma affect both eyes? Most people develop glaucoma in both eyes like I did. Although the disease initially may be worse in one eye, like it was in mine, it was worse in the left eye. With open-angle glaucoma, one eye may have moderate or severe damage, while the other eye may be mildly affected. Over time, the disease damages both eyes. Diagnosing glaucoma. In order to diagnose glaucoma, your doctor may order several tests. This may include measuring the interocular pressure, testing for optic nerve damage with a dilated eye examination and imaging tests, checking for areas of vision loss, such as a visual field test like I did, measuring corneal thickness, inspecting the drainage angle that drains the fluid from your eye. Treatments. To treat glaucoma, your doctor has a variety of options. Number one is eye drops. Glaucoma treatment often starts with prescription eye drops. In my case, I was prescribed 3 different types of eye drops, and these can decrease eye pressure by improving how fluid drains from your eye or decreasing the amount of fluid that your eye makes. Depending on how low your eye pressure needs to be, more than one type of eye drop may need to be prescribed. These were the 3 medications I was prescribed. These are taken twice a day, once in the morning and once at dinner time, and this one is taken right before bedtime. Oral medications. If eye drops alone don't bring your eye pressure down to the desired level, your doctor may also prescribe an oral medication, surgery, or other therapies. Other treatment options include laser surgery and various surgical procedures. Laser surgery is done in your doctor's office. Your doctor uses a small laser beam to open clogged channels in the trabecular meshwork, or a surgery that removes some of the meshwork altogether. They can install drainage tubes, which inserts a small tube shunt into your eye to drain away excess fluid to lower your eye pressure. Tips to reduce the odds or severity of glaucoma might include eating a healthy diet. Eating healthy won't prevent glaucoma from worsening, but it can help you maintain your health. Exercise safely. Regular exercise may reduce pressure or open-angle glaucoma. Limit your caffeine. Drinking beverages with large amounts of caffeine may increase your eye pressure. I was drinking 6 to 8 cups of coffee per day, and that may have contributed to my eye damage. Sip fluids frequently. Drink moderate amounts of fluids at any given time during the course of the day. Guzzling a quart or more of liquid within a short period of time may cause temporary pressure increases in the eyes. Sleep with your head elevated. Use a wedge pillow that keeps your head slightly raised about 20 degrees. This has been shown to reduce intraocular pressure while you sleep. Take prescribed medicine. Use your eye drops or other medications as prescribed. This can help you get the best possible result from your treatment. Be sure to use the drops exactly as prescribed, otherwise your optic nerve damage could worsen. Stem cell therapy to restore vision. There are ongoing studies using stem cells to repair and grow optic nerve fibers. Now, we're certainly not there yet, and it's challenging since the stem cells don't need to just repair the nerves at the back of the eye, but they have to grow nerve fibers all the way from the back of the eye to the occipital lobe in the brain. So technologically, repairing a nerve fiber is no small feat, and there are millions of them. The problem is, in laboratory studies, they have been able to grow nerve fiber, but many of the newly grown nerve fibers would not transmit a signal. So we have a long road ahead of us to repair damaged optic nerve cells. Here are other clues to glaucoma. There are other risk factors for open-angle glaucoma besides high eye pressure. They may provide some clues about what causes it. For example, age is a clear risk factor. Open-angle glaucoma is rare among Americans under 50, but affects nearly 8% of Americans over 80. Other risks come into play long before we grow old, even before we're born, including our ancestry. Open-angle glaucoma is about 5 times more common in African Americans and Mexican Americans compared to whites, and it has an earlier and more rapid course in African Americans. Family history also has a strong influence. A person's risk of developing open-angle glaucoma is about 10 times higher if a parent or sibling has it, and the risk is higher still if an identical twin has it. These data from family and twin studies have prompted researchers to dig more deeply into the genetics of open-angle glaucoma. And it turns out that sometimes open-angle glaucoma is passed from parent to child due to defects within a single gene. 8 such genes have been identified so far, and they tend to cause glaucoma with an early onset before age 50. Thanks to these discoveries, there are now genetic tests that can help people with early onset glaucoma determine the risk that their children will inherit the disease. Unfortunately, it's rare that primary open-angle glaucoma can be traced to a single cause. In the vast majority of cases, experts theorize that the risk of the disease is influenced by many small genetic differences that may vary from person to person. Alone, a single gene probably has a small impact on glaucoma risk. Protecting yourself against glaucoma. Even though the risks of glaucoma aren't fully understood, remembering these tips can help you protect yourself and your family against it. People at higher risk include African Americans age 40 and older, everyone age 60 and over, especially Mexican Americans and those with a family history of the disease. Because glaucoma often has no symptoms in its early stages like mine didn't, people at higher risk should have a comprehensive dilated eye exam every 1 to 2 years. With early detection and treatment, it is possible to slow the progression of the disease and preserve vision. Please like, subscribe, and share this video. See you next time. This is The Business Guy.